Dignitaries on the days, of the days, professors, ladies and gentlemen. At the outset, I must make one or two admissions. I am neither a sociologist or a social worker, I am an economist. For most of you, I may seem out of place. But Dr. Richard Pice brought me into sociology through his friendship and neighboring discipline. Dr. Neil Ratan sir and Dr. Bindeshwar Pathak ji brought me into action sociology and sociology of sanitation. So when we speak about many epithet of Bindeshwar Pathak ji, he is a messiah, he is a toilet guru, he is a miracle man also. He can convert any people from any discipline. He thinks out of the box. And I am a living example to that. Fortunately or unfortunately, in the volume of papers distributed, two of my papers have come. I don't know how it happened. That's another miracle. But I'm not definitely not going to read two papers or deal with two papers. The other one which I'm not touching is research areas for sanitation. I'm not touching on that. Mine is urban sanitation in particular. I've reframed the title from that book. Poor sanitation hurts urban planning. We have urban planning, but that is not going on well because of poor sanitation. Most of the time, we think that it's all rural areas. We blame on rural areas. There is poor hygiene, health, and poor sanitation, and urban areas are doing well. But we most often don't look under our very nose. Take the city of Delhi. I have had experience of using public toilets in the monumental places of Delhi. I had to come running out of it than using it. If this can happen in Delhi, then how could be the other mega cities, smart cities of India? So I think we have to be really careful about it. The problem, as somebody said, is very close, not far away. So I thought, even though we are all belonging to the cities and urban areas, we should not simply blame the rural areas. We have to look at our own problems. Urban areas generate 60% of India's national income, but 40% of urban disposal or waste is not properly disposed. Are we really educated or cultured? So, my first book on sanitation was Culture of Sanitation. Before moving on to Economics of Sanitation and Sustainable Sanitation, where I have traced sanitation from Indus Valley to Sulabh International. Looking into various countries and states of India, how the practice is and the need. In today's paper, I speak about the 11th Sustainable Development Goal for resilience and efficiency. These two words, resilience and efficiency, are nearly used 30 times in the document. Particularly for urban areas, sustainable development is a must. And that is because our urban areas are suffering from the major issues of health and hygiene depicted in poor sanitation. Because of sanitation or poor sanitation, GDP falls by 7%. This is the economics we have to carefully look at and not say that economics has nothing to do with sanitation. Sanitation has a huge economic cost. Sanitation economics is growing in developing nations slowly, looking at the investment in toilet related resources. This was admitted by none other than Professor Keshav, an economist from Bangalore University. In fact, he wrote the foreword to one of my books. So the true cost of sanitation is the economic cost of lack of sanitation in relation to mortality, productivity, healthcare, and access. In 2015, lack of sanitation cost the global economy US dollar 222.9 billion. So billions of rupees are lost because of poor sanitation. Why I'm stressing on urban areas is this is our house, urban house, ecos, but we have not managed the house properly. Economics is management of the house, ecos and nomas, but we have not managed the house in the required manner. We have to look at the circular economic feasibility. Is there a value up in cycling toilet resources? Can we scale up the business models of sanitation? Does the system attract large industrial buyers? So on and so forth. And even microeconomics is part of sanitation because every household has to plan its sanitation, health, and hygiene by asking itself what are the opportunity costs from raw water and wastewater? What is the transport cost related to water to the city? How can rainwater be used for drinking? How can urban household treat the wastewater? How to collect the sewerage, wastewater treatment and discharge of wastewater and costs and damages, which we call as negative externalities in economics. We also have to conduct a cost benefit analysis for water and sanitation economics. A study has found out that poor health and hygiene in Indonesia and Cambodia are the major reasons for economic losses. It is not recession, it is pure sanitation that is the culprit in these countries. So we must plan about a sanitation economy, sanitation business model, and sanitation economic entrepreneurship, and new financial models of sanitation. So we are really appreciating the Sulabh initiatives in this direction because their models are low cost models, high tech and infrastructural intense models. Sanitation, health, and economy. All populations above 158 and 172 people per hectare has to be concentrated in good sanitation facilities, simplified sewerage and treatment cost. But 1.7 billion people lack private toilets or latrines in India. At least 10% of the world cost is because of poor wastewater management and irrigated cost. But at the same time, good sanitation has got some economic benefits. There will be low cost of healthcare because of less tropical diseases and their better treatment, minimizing malnutrition, and also solving water related problems. So the challenges are really severe. The situation is going from worse to worse. Urban areas poses growing challenge in their living increasingly in the cities because of poor sanitation. So we have to divide these topics for further studies into health and economy, water economy, women and economy and sanitation, children and economy and sanitation, and Indian sanitation history and culture. It's very good to note that some programs are already coming up in the name of Swachh Bharat Mission. Better strategies are being implemented by the government for strengthening the district level institutions, for empowering local bodies, for managing the sanitation. So planning has to be done not in just in terms of general sanitation environment, but also in the times of the pandemic. So slum sanitation has to uh, gain momentum in Indian situation. Similarly, as I told you in the introduction, when we speak about smart cities and smart cities mission, we must see that there is enough water, there is guaranteed power, sanitation and waste disposal, urban transportation, community digitalization, e-governance and citizen participation. The planning, implementation and monitoring make the mission smart and evolving. We must also think about shelter and sanitation for payment dwellers. This is one area that we have not touched much. So payment dwellers problems. We have just in general touched upon slums and sanitation, but not payment dwellers. Sanitation and slum development program is already implemented. Jawaharlal Nehru Urban Renewal Mission is in place. There are urban bodies looking into these problems and amenities required by the people of these areas. We have to plan ahead. So, my suggestions are as follows: exploration and preparation, planning and feasibility, formal planning and zonal planning, design and execution, operation, urban farming, healthy diet, controlling food waste, greener or greening for healthier environments, connecting cities to rural areas or urban, what we call as better local governance and financial management. These are how to stop slums, urbanization in a healthy manner, not eviction, not the bulldozer policy of clearing the slums, but long term and sustainable decent housing facilities for the urban areas. So, Swachh Bharat program and SWM programs, municipal waste management and solid waste management programs will come in very handy. And in the post COVID 19 situation, quarantined household waste disposal also gets due attention. So urban sanitation, India has to take care because already 27.78% of its population is urbanized, living in urban areas. 21.8% of Delhi slum holders use public taps and public toilets. So we have to pay real attention to the urban areas of India. Defecation, open defecation, undrinkable water, dense living, uneducated people, poor health and diseases on the rise, education decline, deflation. So India must come forward to have a national policy on fecal sludge and septage management. It has already started that in 2017. Surveys have been conducted and strategies have been decided. In conclusion, I would like to say that city houses half the world's 7.5 billion people, and therefore we have to look within the cities before we think in terms of the worldwide or the neighborhood. So the UN Environment Rockefeller Foundation has made preparatory meetings for this shaping of the urban agenda. City population, infrastructure, runoff water, urban heat, island effect are all getting due attention. Development of green space, making city more resilient. So, in this connection, we all have to take a pledge to make our cities a livable cities. And conferences like this are useful because we meet with administrators, experts, citizens all together, talk to everyone, raise awareness. Instead of waiting, look and see what you can do now in the realms of our possibilities. Find someone who can keep in us in the momentum. That is, Sulabh is keeping people on the track. Everyone is becoming an action sociologist, not just a theoretical expert in the subject. So it is engaging people. I congratulate Sulabh for this, engaging people in the socialization in the problem of sanitation. And second suggestion I would like to make to Sulabh is bring the people into it and start with small activities. You do not think large and big. Start small. Small is beautiful. Make some intervention locally and then in a larger way. So no one likes secrecy. Sustainable urban planning requires everyone to get involved and everyone to get dirty. Thank you.